Hi, our presentation is on expenses for raising a child with autism. These are some autism facts. Autism is diagnosed in 1 in every 68 children, including 1 in every 42 boys. Every 20 minutes, a child is diagnosed with autism. Autism is just as prevalent as juvenile diabetes, pediatric AIDS, leukemia, and muscular dystrophy combined. Continuing on, the lifetime cost to support an individual with autism is greater than $2.4 million. The majority of autism treatment options are also not covered by insurance. Next, I'll be talking to you about medical expenses. The annual cost of autism therapy can exceed $40,000 to $60,000 per year. Medical expenses include inpatient, outpatient, emergency, home health care, pharmacy, and out-of-pocket costs. Occupational and emotional therapy costs an average of $150 per session, which the families have to pay themselves. Continuing on, many health insurance plans exclude treatment for autism or outright refuse to cover behavioral-related therapy, which forces parents to pay out of pocket. On average, it is an extra $3,000 a year for doctor visits and prescriptions.
Now we will be talking about educational expenses. Children with autism are required to have learning environments and instructions that could be beneficial. Some examples are special camps, swimming lessons, and social events, which can be expensive, up to a few $100s a month. On average, it costs more than $8,600 extra per year to educate a student with autism. This is added on to an average student cost of $12,000. Now we will be talking about special equipment expenses. Oftentimes, children with autism require specialized equipment to learn. Studies have shown that iPads help these autistic children relate to the world, and these could cost upwards of $500 for a basic model.
Next, we will be talking about job limitations of people raising children with autism. The rate of underemployment among adults with autism exceeds 90%. Many parents will choose to quit their job and stay home to care for their autistic child full-time. In a two-parent family, one parent must carry the burden of earning enough money to support the family. On average, parents' lost wage costs an average $18,720 annually for the care of a child. There are also residential care expenses. Residential care is the largest average expense for adults with autism, costing between $18,080 and $36,161 annually, which is more than twice the amount spent on medical care. Lost wages for adults with autism cost about $10,718 per year.
Next, we will be talking about how raising a child with autism affects family life. Often, families will move their homes to different states that can be more beneficial to therapeutic expenses. For example, many families will move towards Massachusetts and New York. 70 to 80% of parents with a child with autism will get a divorce, which leads to split income.
In our last point, we will talk about behavioral intervention. In addition to medical costs, intensive behavioral interventions for children with ASD cost about $40,000 to $60,000 per child per year.
Thank you for listening to our presentation. Here are some of our references.